How you doing, sir?
Hey guys, how's it going?
All right. You guys have a good day, huh?
Hey, Edmundo? Can I talk to you for a second?
I'm good right here, sir.
Alright.
Do you have your name and badge number, sir, please?
Yeah, I'll give it to you at the end, okay?
Yeah, name and badge number, please. Yeah, no.
We'll give it to you at the end, alright?
No, I'll give it to you. I'm asking for it right now, sir.
Okay. So, do you go
Can you
by
please identify, please?
Officer
name-
Topender, San Jose Police Department,
Badge number?
5041.
Thank you.
All right.
Please identify, please.
Guerrero, badge number 4995.
Thank you. Please identify, please.
Officer Ramirez, badge 4085.
Thank you, sir. Sir, can you please identify ID? That your partner over there?
Hey Ed,
So Ed, we gave you our names, okay? If you want his, we'll be.
Can I get your name and ID, sir?
Listen, you need to
Okay,
talk
thank
to
you,
my
sir.
partner, okay?
I'm listening.
he just told you, so can you talk to me for now? So, Ed, have
Just
you
so you
talked
guys are aware, we're wearing body worn cameras and you
That's
guys are
fine.
also being
Yes,
recorded.
we understand. That's all fine.
Okay, all right.
That's all fine. That's all fine because I'm gonna FOIA all these.
Yeah.
That's fine, and then
Yeah.
this will be uploaded for
Most,
our evidence,
that's
okay?
great. That's good. I'm well aware of the procedures, sir.
Okay, thanks.
Alright, Ed, so we talked to the staff here, and it's their policy, and
Be very careful what you say, sir, because policy don't trump law, sir.
alright,
Policy does not trump
So
law.
they're
It's not a
asking you-
mandated state. Are you lawfully?
they're asking you to put on a mask for the doctor to see you.
And I kindly decline, sir. And it's my right to, sir.
Okay, and then the doctor doesn't want to see if you're not going to be following their policy and putting on a
Well, that's fine. The doctor can call me on my phone right here and then reschedule my appointment then. You know, that's fine. I ain't got a problem with any of this.
No, that's it.
You know, but like I said, I'm well aware of my rights, just like you guys are well aware of right. You guys walked in without mask. It's your policy to, yeah, you put one on as soon as they handed you one, right?
Can we hand you a mask and
Right.
put it on?
Negative, sir, because it's my right not to. I'm in a public forum. I'm in a public lobby. Therefore, are you going to trespass me?
No, Edmundo, no one's trespassing.
Okay.
You. So she works for the clinic. You asked the doctor to call your phone, right?
Sure.
To reschedule or do
Sure.
some phone appointment?
Sure.
So she'll explain that to you, okay?
That's fine.
So either one of the clinic managers or the MA will call you to reschedule.
That,
and then
she's right here. She can call me right now. We can reschedule. And either way,
Dr. McRaven's seeing patients.
that's
right now.
fine. And she's going to be seeing my fiance right now too. So I still got to wait for her in this lobby until she's finished. So I will be sitting here for the next hour or so without a mask until my wife is done with her appointment. Okay, just so as long as we make ourselves clear.
We'll talk to you about that as well, okay?
Okay, that's fine, sir.
So, do you have any questions about rescheduling your appointment?
Not at all. As a matter of fact, not at all. That way I can just, it was not at all. Like I said,
Okay. All right. Do you want to tell them about the lady in here without the mask? You're going to explain to them.
Yeah, so Edmundo, waiting in the lobby as well, for their policy requires you wear
this
a
is
mask.
public. This is a public clinic. This is a public lobby. So therefore, the policy don't trump law, sir. I know my rights, sir.
Okay, when you came in here previously, you wore a mask though, right?
Negative,
No,
sir.
you didn't?
Negative. I haven't worn a mask in all my appointments coming in here, sir.
Okay, now they're asking you to wear a mask. You can wait here for your wife's appointment.
And I plan to do that without a mask, sir.
Follow their policy.
I don't need to follow anybody. That's your guys' policy. That's county policy, and that's city policy that you guys are mandated to wear masks, sir. I'm my own private person. It's my choice not to wear one. So with that being said, I'm in a public forum. I'm in a public lobby. You guys cannot force me to wear a mask, sir. So with that being said, you guys have a good day. I'm gonna wait for my wife to finish her appointment, and I'll be on my way.
Let me call let me call Sam.
You mentioned you had a medical exemption?
I don't answer questions, sir. That's all I'm gonna say to you.
I mean, you told me at first.
Like I said, I don't answer questions, and like I said, I shouldn't even told you that, okay? So if it's an exemption, my doctor is gonna explain that to you because that's violating HIPAA law. So
did.
with that being said, we'll leave it alone. So you're saying that my doctor talked to you about my
I
medical
don't know if
history?
you have a medical exemption or not. I'm asking you. Which you
Well,
told me
like
earlier.
I said, if you heard what I said, then we'll leave it at that, and I'm not gonna repeat myself. Okay, so we'll leave it at that, sir.
Okay.
I'm well within my rights, officer. Okay? Well within my rights. So you gentlemen, you guys have a great day.
Hey, Edmundo.
Yes, sir.
So the doctor here in charge is asking you to leave the property. Okay.
Go ahead.
So just,
Is that a lawful order, sir?
yes, it is.
Okay, now,
Okay.
if that's a lawful order,
Okay.
okay, I will
This is
accept that
per the
lawful.
doctor.
Okay,
You
no,
understand that?
this has got to be a lawful order per
No,
you, not
this
per the
is-
doctor.
I
or
don't
if it's-
own this building.
I know that, and neither does she.
No,
We
she
own
does.
this.
She
No,
does.
she is an
She's in
employee.
charge of here.
She's an employee of this facility. I'm a
Okay.
taxpayer. We fund this building,
Okay.
sir.
Do you want me
Okay.
to have an employee
This is
tell you
a
this?
county building,
There's no
right?
need to.
Well, I'm gonna have it do it.
That's
anyway.
fine. She just
Can
did.
you tell him that you don't want him in this building or facility if he's not wearing a mask, so that we're clear?
Yeah, so there's a state order that you have to wear a mask in healthcare facilities.
There's not a state mandate, ma'am. I'm sorry. Okay, let me interrupt you.
Finish,
There's
and
no
then-
need,
and then
sir.
you can-
There's no
you
need.
can-
That's a county policy, ma'am,
She's
sir.
explaining that to you.
There's not a state mandate. If there was a state mandate, sir, I'd wear one.
Okay.
Just like when there was a state mandate. I don't got a problem abiding by the law because it was a state mandate. We don't have a state mandate. That's a county and city policy. You see what I'm saying? So therefore, I'm well within my rights.
There is a state mandate for healthcare facilities.
Incorrect, ma'am.
I looked it up just to make sure.
You're incorrect, ma'am. You're incorrect because I looked it up too, and I talk to my attorney about it every day because I got a civil suit going on right now for the simple same reason. So best believe I'm well within my rights. So be careful and tread on. Be careful what you say, ma'am.
I'm really confident and there is a state order in healthcare facilities.
Like
that
I
wear a
said.
mask. And so we're gonna have to ask you to leave if you're not gonna wear one.
And I'm going to kindly decline, and I'm going to sit here and wait for my wife, ma'am, for her appointment. You know, that's all I'm going to do.
They're willing to have you placed under arrest for trespassing. If
You can't trespass in public, sir. I'm in a public forum. I'm in a public lobby,
No,
sir.
we don't want it to get to that point. That's.
Well, if you want to give me a lawful trespass, I'll take the lawful trespass and write it up, sir, and then we'll take it to civil litigation from there. Okay? That's all you got to do. You ain't gonna have to arrest me, but go ahead and write me up my lawful trespass, and that's coming from San Jose PD, not from a nurse from this clinic.
Okay.
Okay, so if you want to lawfully trespass me, sir, I'll definitely take the trespass if that's what you're going. Just
Okay.
keep in mind, we're on a county
Okay.
clinic,
That's fine.
county
If you wanna
lobby.
Take it to civil litigation, we can do that.
If that's the route you want to take it, sir, I'm well within my rights. So if you
Okay.
want to go ahead and write up the trespass,
Okay,
sir.
but you will
you
have
know,
to leave, you know that.
Most definitely.
Okay.
I'm not going to disagree
Okay.
with you, sir. I know my rights.
Okay.
I will wait outside for my wife. No worries.
All right, no,
But go ahead and get the paperwork going, sir, if that's the route you want to go.
Right? Okay, we're gonna do this. All right, sir.
Definitely.
Okay, private.
You are not a private facility. You are a county facility. This is Santa Clara County Indian Health Center.
No, it's,
Funded.
no, it's not.
Yes, it is a county facility.
I'm the director of clinical services. I know where my funding comes
And
from.
where does it come from, ma'am?
It comes from.
From the taxpayers of the county and the state.
Third-party revenue is the majority grant fund.
Regardless, so therefore it's still a public entity. Just like if you accept Medi-Cal, you accept 80% of your Medi-Cal patients here are a public entity to the state. So therefore, you are dealing with a public entity. So therefore, this makes it a public facility. Okay?
We have paperwork.
Yeah, go ahead and get the paperwork done. I'll go outside with you guys. I'm not trying to rebuttal
No,
with you
no,
guys. I
we
just know my
understand.
rights and I'm standing up for my rights.
Mundo, look, there's a lot of times where like, I don't want to wear a mask. Right?
I understand, just like you officers came in without
Right,
masks until they
right.
handed them to you. I get it. I get it.
But we are, unfortunately, we have to follow what, we just have to wear masks.
You do not have to follow. You have to follow your policy
Right.
because it's in your policy to identify and wear your policy
So-
and mask. Just
so
like it's in
we'll-
their
we'll-
policy as employees to wear masks.
And
Not us
Right,
patients.
right.
Not
So
us
we'll do
patients.
what we have to do, and then you.
Like I said,
do what
I'll
you
take
have to
the
do.
lawful
Okay.
trespass coming from Officer Ramirez, correct?
Yeah, it's gonna come
And
from
can
us.
you please say it again that you're going to lawfully trespass me in
you'll
public?
Get the paperwork.
Okay, and you're going to lawfully trespass me in
Everything's gonna
public.
Be on that paperwork.
Very well.
Okay.
Very well. Thank you.
Yeah, just give us a minute. He's gonna.
You know, and I'm not going to be leaving because my wife still has an appointment.
Well-
So I'll be outside.
Yeah, of course.
The public sidewalk is fine with me,
No, that's
even in
fine.
the public parking lot back there.
That's fine.
You
That's
know?
perfectly fine. Yeah, that's fine.
You know, but you're not going to sit here and try to bully me and try to tell me and force me to wear a mask. It's not the way it works. You're the director of all people. You should know that.
Following our policy.
You need to follow policy. We don't. That's not a lawful order, ma'am. Okay, when it's mandated by the state of California, then I'll respect that and I'll wear a mask like I used to. But it's not. It's a city policy and a county policy that your directors are high above placed. If that was the case, ma'am, do you think I'd be standing here right now? They'd have me in handcuffs and in the cop car. So you know I'm well within my rights. That's why they need to lawfully trespass me in a public lobby, in a public facility. So you guys are setting yourself up for a lawsuit. Know this.
That's fine, you know.
I understand. We're all within our rights, but like I
We
said,
don't want nothing to escalate.
no, believe me, I'm here de-escalating. That's why I'm letting you guys know.
So can you do me a favor? We know that you're not happy, and I get it, but can you just kind of not direct any more words towards her?
I've never said anything to her.
I know. Just-
We're all
just so
with,
that-
we're all here amongst a
I know,
group,
but
so it's
listen-
my right to speak to her.
Right, but there's no need. There's no need.
You know, you should have been here. Did you guys watch the video? How they were yelling at me, disrespecting me?
You've made your point, right?
Thank you.
You made your point.